Good morning. I see the number's still climbing. We're going to give it just a minute. Thank you. Okay, it looks like the numbers have leveled off, so we will go ahead and get started. Good morning, everyone, and welcome to the 2021 Kentucky Health Information Exchange Annual eHealth Summit. And I am so excited to be here to this day. This is one of my favorite events that we do throughout the year. And although it's not in person as we would all like and we would hope for, it is still a good opportunity for us to come together, to get to showcase some of the work that we're doing, to get to talk about other cabinet initiatives that's going on, to get to network with our peers, with KHI staff, and to really just have a good time. So I'm thankful that although we are virtual, that you are all here with us again this year. Hopefully for the future, we will be able to return back to in-person as things continue returning to normal. So thank you again and welcome. So before we jump into the day, I wanted to take a few minutes just to give a little update on KHI, a little bit of the past, the present, and the future. And so we're going to jump into some slides. If you know me, I always have slides. And first, let me introduce myself. I'm Andrew Bledsoe. I feel like most everybody on here, as I look through the participant list, knows me. I've been able to talk with many of you, and normally this event just feels like a big family gathering. So I can't see you, but I know that you're out there. And but if you don't know me, I'm Andrew Bledsoe, the State Health Information Technology Coordinator and the Deputy Executive Director for the Office of Health Data and Analytics, where I have the pleasure of overseeing the operations of the Kentucky Health Information Exchange. And what a pleasure it is. The work that we do is incredible, and I'm honored to be able to be here and to get to do this on a daily basis. Before we jump into these slides, I would like to first start by thanking our sponsors and our exhibitors. We could not put this on without them. And so I thank you for continuing to support us, for sponsoring the event, for exhibiting at the event. It means a lot to me. It means a lot to our team. And so hopefully there will be good interaction with our participants throughout the day. I encourage you to go to the exhibit hall and interact with those sponsors and exhibitors. I also want to thank the team for putting together the eHealth Summit. It is very much a team-produced event, and we have 3 team members who work tirelessly, especially in the last couple of weeks, all hours of the day, putting the event together. Ann O'Hara, Teresa Poff, and Brandy Janot, thank you so much for working so hard to put this together. I really appreciate everything that you do. And also the broader team that all comes together to make this happen. Every member of KHI is a part of the eHealth Summit in some way, shape, or form, and have been a part of contributing to putting this on. And so I appreciate everyone being able to come together so that we can put this event on. Thank you all very much. I also want to thank the Kentucky Regional Extension Center for their work in helping to facilitate this event and ensuring that we are able to continue to put this event on. They have additionally worked with us probably over the last year to be able to ensure that we have this event and it goes smoothly. So thank you very much to the Kentucky REC for everything that you do. Okay, with that out of the way, I'm going to jump into these slides and we're going to talk a little bit about KHI, the past, the present, and the future. So since our first connection in 2010, KHI has grown to become one of the largest statewide HIEs in the nation. Now, we are unique in that we are a statewide HIE. There aren't that many of them across the United States, and we're also unique because we are in state government. It has many benefits. As many of you know, it allows us to have access to data sets across the cabinet, other programs help to support other departments. We're able to work very collaboratively for the citizens of Kentucky. But what we don't often talk about is how we've become a national leader in the HIE landscape. And we've grown to be one of the largest HIEs in the nation as well. We are first in the number of overall connections. So in the number of individual feeds that we have feeding live data into the HIE, we have one of the largest grouping of feeds of any HIE. We are first in unique patients searchable in the Master Patient Index. We're nearing just about 9 million unique individuals in our Master Patient Index. And so that is incredible when you consider our state compared to some of the other states in the health information exchanges out there. So we have a tremendous amount of data that's flowing through us. We are second in the number of participating organizations connected to KHI. So this is participants who aren't just contributing data, but are also utilizing our services as well. And we are one of the only HIEs that are now working in the image exchange or image enablement space. So we are connecting to PACS and exchanging diagnostic quality images. And you'll hear more about that later on this afternoon. So we often, I know I myself and our team, we get into the day-to-day of the work that we're doing, and we don't often realize what we have built, what we've accomplished, and what we've achieved. And so I wanted to take a minute just to put it out there and demonstrate to everyone in attendance here that Kentucky is extremely fortunate to have the Kentucky Health Information Exchange, because we are one of the largest in the nation, and the services that we are offering are extremely innovative compared to what's being done across the US. So it's certainly something that not just we, but the state as a whole should be proud of as well. Now, many of you may remember 2018 and 2019, we underwent a large technology replacement, replacing the old HIE technology infrastructure with new technology infrastructure. And so we do a lot of measurement now against the 2017 statistics and numbers, because that was the last year that we were really doing onboarding to the HIE. And so what we have seen and what we've measured is since that technology migration, we've seen a 135% increase in live data feeds. That's a lot of additional data that we are now able to have access to and exchange within the HIE. We've seen a 63% increase in participating organizations connected to the HIE. And so I believe this is from a lot of the usability that we really honed in on during that implementation, and making sure that everything that we were building was valuable and was usable. We've seen a 155% increase in healthcare locations. So more than just the organizations that are contributing data, the physical locations have increased as well as we've continued building our network. And then 100% increase in individuals available in the Master Patient Index. Prior to the migration, we were around 5-ish million. And as I said, we're getting near 9 million unique individuals. So even through the technology implementation over 2 years, we've still been able to maintain a considerable amount of growth in the last couple of years as well. Now that was kind of extreme past. I want to talk about the past year. Since we last spoke, last December at the 2020 eHealth Summit, we have been busy. And so some of the things that we've done, as we had noted previously, is we worked very closely with the Department for Public Health on the COVID-19 response. So we facilitate electronic lab submissions to the Department for Public Health, which goes directly inside of their disease surveillance system and onto the contact tracing that's used across the state at the local health departments. Through that work, every lab is required to be transmitting their COVID test results through KHI, and we have transmitted over 4.5 million COVID-19 tests since we started this last March. Not only have we seen 4.5 million tests, but we have, prior to the COVID pandemic, we weren't working with really any commercial labs, only reference labs were we receiving lab test results from. Since then, our team has been able to onboard over 340 commercial labs to be transmitting COVID test results directly into the Department for Public Health. Something that I'm really proud of, because with every lab test result that's electronically transmitted, that means that that is saving time on the front end for the individual collecting the test. That's time that they're not having to manually fill out a result and fax that. It's saving time at the Department for Public Health and the local health departments, because they're not having to manually input that data into their disease surveillance system. So there's a considerable amount of return for that investment there. And I'm extremely proud of that work that we've been doing in helping to expedite a lot of the response that can be provided through contact tracing from the local health departments and access to other services as well. We've additionally built out new opportunities. This was new opportunities for reporting lab test results, but also our electronic case reporting. And so with every positive COVID test result, a case report must be submitted. We have went live with the ability to electronically capture that information in an EHR system and send that directly to the disease surveillance system within the Department for Public Health. That's also available to the local health departments and when necessary for contact tracing. And so we've seen, I don't have the numbers on that, but we've seen a tremendous uptick in the organizations who are able to electronically transmit that information, again, negating their requirements for manually filling out a form and submitting that information to their local health department, who then has to manually upload that information. So really streamlining and automating the process for case report submission as well. Now, not every EHR system is capable of electronically transmitting that data. So we have additionally just recently opened up a new direct data entry opportunity for electronic case reports. If you're familiar, we had a direct data entry option available for lab test results. It's still available and utilized where appropriate, meaning if an electronic connection cannot be established, participants could log directly into the HIE and enter the information associated with the COVID lab test results. So we've expanded that to our electronic case reports so that the case report information can be input or automatically uploaded into the HIE, so that then that is then transmitted onto the Department for Public Health and local health departments. Again, the goal here is to more streamline this process for everyone involved, to make it more automated and less manual data entry for everyone involved, reducing any errors that may occur during manual data entry. That has just launched within the last couple of weeks. And so we're excited to be rolling that out, and you will start seeing more communications on that coming from our office, training starting to occur as we'll be provisioning access for that system. Now, both the direct data entry currently is being utilized for COVID only for lab results and case reports. We are working on opening that up to all communicable diseases as well, so that not only COVID, but any communicable disease that is found to be positive and needs to be reported to the local health departments can be done so through KHI if an electronic connection is not available. We know that not every EHR system is capable of transmitting that information. Kind of moving on down the list, our event notifications. This is a premier service and our ability at proactively sending information out to participants. And so through the event notifications, when you tell us what patients you want to track, anytime that they have movement tracked within the HIE, we inform you in the way that you want to be informed. So in June 2021 alone, just under 900,000 event notifications were sent through KHI. So we've seen a significant amount of uptick in the utilization as we've been rolling that out to participants. Our participant engagement has continued to skyrocket as well. We have over 2,000 physical locations who've been onboarded to contribute data, and 3,300 healthcare professionals who are using our web-based portal to have access into the patient record, the comprehensive patient record. And so that actually just launched a little over a year ago. So to already see that we're at 3,300 users of that system is incredible. You will also hear more about that later on today. Registry connections continuing to support the Department for Public Health. We've been also working on some additional communicable disease reporting not previously done. That would be lead, STDs, and HIV can now all be reported through KHI to the Department for Public Health for disease reporting. So we've expanded those capabilities over the last year, as well as launched into one of our larger projects for image enablement exchange. And so we are, as I mentioned previously, connecting to the PACS systems. And another large project getting ready to launch at the end of this month is our connection to the Connect Resources platform to do work with social determinants of health. Through this, we're bidirectionally exchanging data between the HIE and the Connect Resources platform to make a comprehensive solution that benefits the citizens of the Commonwealth. And so you'll hear a presentation at 11 o'clock today on that project. Now to look towards the future of where we're going. One of my main goals and initiative is to really hone in on data quality. With the launch of the new technology platform in 2018 and 2019, we have set in place a lot of data quality standards for new onboarding. Our goal is to conform to those standards as much as possible, because what that means is our data becomes more usable when it's quality and accurate data. And so it makes it more usable for you if you're pulling information back to your EHR system, if you are looking at information in the ePartner viewer, if you're receiving event notifications. In order for that to work appropriately, the data must be of high quality. So we are really focusing in on that for the future, setting standards for all of future onboarding, as well as revisiting all of our previously connected feeds to ensure that the data quality is what we need it to be for our services to continue to function. We have a data quality project manager that is going to be launching into this initiative and expect to be working with participants for the foreseeable future. Continuing to work on our user outreach, both for collecting data from facilities, but as well as rolling out the services that we offer that support healthcare facilities as well. We want to make sure that not only are participants contributing data, but they're using our data as well. Partnerships is always important to me. I just believe in the power of collaboration. So I want to continue to further those collaborations. One that we've really done a lot of work with is the Kentucky Primary Care Association over the last couple of years. They've helped us tremendously as we were launching the new system, testing out a lot of our capabilities, and are always one of the first to be able to pilot any of our services. And so I want to continue that partnership, that collaboration, as well as roll that out to other associations, other organizations across the state, as well as other departments within the cabinet as well. We're going to be really pushing, rolling out the image enablement or the image exchange component, connecting to the PACS systems, really making that record on that patient that we maintain as comprehensive as possible. Continuing to focus on our event notifications, making sure that the notifications that we provide are relevant and accessible in a format that you would like to receive them, and then really working on our social determinants of health. I'm so excited for you to hear today at 11 o'clock what we are launching into at the end of this month. Please make sure that you come and listen to that session. What we are doing is going to be tremendous, but the opportunities that we will have resulting in that work will also be tremendous. So I think there's a lot of opportunities there for the future, and I'm excited for you to see what we're working on. So that's kind of our past, present, our future, or a state of the union, so to speak, on the Kentucky Health Information Exchange. The rest of the day is going to have conversations. Our keynote speaker will be speaking on federal policy and how that impacts Kentucky healthcare organizations. We're going to have the same panel from last year, if you remember, at the eHealth Summit, speaking on that from that federal policy perspective. What does that mean here for the residents of Kentucky? What does that mean for you? How do you put into place anything that may be necessary? How do you meet federal policy requirements? And then what does this mean for patients for the future? And then we're going to start talking at 11 about our work with the Connect Resources and what that means for individuals in the Commonwealth. This afternoon, we're going to have repeating sessions at both so the 1 o'clock sessions will be repeating at 2:30. So if you see one that you want to attend and you can't be in two places at once, have no fear, you'll be able to access the same sessions at the 2:30 time slot. A few logistics before we wrap this up. You've already made it into the auditorium. You're in the session, so really most of the work is done. I hope you're enjoying the platform. I think that this platform really helps it to feel more like we're at a virtual summit as much as possible. You'll be able to access resources. If you go back to the lobby of the platform, you can have access to the exhibitors, the networking lounge, if you need any assistance. It's also available across the top of your screen if you want to access those at any time. We did bring back the Adventure Challenge again from last year. That was very largely successful. And so throughout the course of the day, as you attend sessions, as you network with exhibitors, as you go into the networking lounge, you will get points, and the 3 individuals with the most points at the end of the day will receive a gift card. And so I encourage you all to come back to the 3:30 session to find out who the individuals are that will be in the winners of those gift cards, as well as you can check the leaderboard, and that will give you up-to-date statistics on who is in the running. We also have, I'm sorry, there's not 3, we have 5 individual winners this year. And so in addition, I want to say that as you're going in to gain those points by talking with exhibitors, talking with our sponsors, going into the networking lounge, you do have to do more than just walk in the room. You need to engage with those individuals, ask them a question. They're spending their day with us to be able to talk with you. So just ask them a question about what they're doing, what some of their services are. You'll likely learn something that you didn't know, and you'll be able to meet some new people. I would encourage everyone to head to the networking lounge. If you hear about something throughout the course of the day that kind of piques your interest, we have formed the networking lounge around our services. So during all of the breaks throughout the day, there will be individuals looking to or available to talk through each of our services. For example, we will have the our Platinum Connection. Someone will be able to talk to you about our Platinum Connection if you hear us mention that. If you have questions about our ePartner Viewer, any of our services, they all have a space in the networking lounge. Please go talk to our KHI staff who are positioned there to be able to answer any questions that you have. I actually think that that closes out all of my announcements that I have. And with that, I want to introduce the Cabinet for Health and Family Services Secretary, Eric Friedlander. He will welcome everyone and kick us off for the day.
Welcome to the Kentucky Health Information Exchange eHealth Summit. Yet again this year, we find ourselves in the virtual summit, which it's the eHealth Summit. Shouldn't we be thinking about doing it virtually almost every year? However, we're virtual again because of COVID, this time because we're seeing an increase in COVID due to the Delta variant. I would be remiss if I didn't tell you when you went indoors to remember to mask, and please get vaccinated against COVID. It's something we can all do for each other. You might hear me say that again. So, this year of COVID, a year later, we have worked together and really in many ways done things that none of us thought was even going to be possible before last year. We switched to virtual and telehealth and brought that ahead by a decade, maybe 2. And it worked well, and it continues to work well. We're going to try to learn from that and continue to do things that are important and smart and the ways that we probably should have been doing things maybe 10 years earlier. Another piece that's been really successful is our health information exchange. KHI has made a tremendous difference, and we're so lucky that we had it in place. Millions of vaccinations, millions of case reports touched the KHI system and worked. Our system was able to rise and meet the demand and meet the challenges of the times. This is something that we are so fortunate that we have been building now for years. We'll continue to build. We'll continue to work together to make improvements, to make things more seamless for providers. We've been able to use information to inform folks even within the cabinet in the foster care system. These are improvements and streamlining and breaking down the walls of our silos that make a difference in the health of Kentuckians. So those of you attending this summit, enjoy the summit, we'll learn together as we've learned together for this entire past year, and we'll continue to make improvements. Thank you for your creativity. Thank you for your participation. We made it, and we made it through together, or we're continuing to make it through together because of you. So let's continue to work together. Let's continue to make a difference. Let's continue to mask up. And let's continue to get vaccinated. This is for our health and the health of all Kentuckians. And KHI supports all of that. So I think we can be thankful and proud of what we've done together. And now, let's get on with the conference.
Thank you, Secretary. Certainly a very timely message this morning. Appreciate that. At this point, we are going to conclude the opening session. So we will actually close this session out so you can leave this session, or Brent will actually kick you out of the room and head into the next session. So you'll have to go back to the agenda and click into the keynote session to be able to access that. Thank you all again for being here. I'm sure we'll be networking throughout the day. Have a good day.